We're gonna do a facial analysis and a reveal of certain plastic surgeries that Ariana Grande may have had. At the end, I'm gonna summarize all the procedures and the approximate prices, and so you'll see that summary at the end of this talk. And also, please check out our new merch. We have hoodies that are all about body positivity, and I think you guys will enjoy it. We'll have more items in the future, but for now we have this one hoodie, and so we want you guys to check it out. Let us know what you think. Partial proceeds go to charity, so please check it out. That's in the description below, of course. So 2009, so Ariana is 16 at this point. And what I want to highlight here are her sort of beautiful features of youth, right? And then we'll see how things may have changed over time. Obviously, this was before any kind of surgery. I just want to point out a few things here. So one is that if you look at her eyebrows, the tail of the brow and the head of the brow, so the lateral aspect and the medial aspect, are on the same horizontal plane. And that's a very youthful thing, and that's something that we look for when deciding whether or not to do a surgery. The lateral canthus of the eye, which is the outer corner of the eye, lives slightly higher than the medial corner of the eye. Not much higher, but slightly higher. It's another youthful feature, and actually there's a functional aspect to it, which is that when tears are made in the eye, you want them to flow towards the nose, and so that's partly the reason for that cant of the eye that we have in youth. If you look at her nose, she has a very natural shape to it. There's a slight bulbosity to the nose tip, but it's a very soft, natural nose. There's a heart-shaped aspect to her face. The lips have very natural proportions, where the lower lip is actually larger than the upper lip, which these days that aesthetic principle has kind of been distorted a little bit, but in classic beauty and just the way that most of us are born, that is a very natural feature of the bottom lip being slightly bigger than the top lip. Again, it's different across different individuals, genders, ethnicities, but at least for her, that's a very natural look. Also look at the contour of the jawline. Just keep in mind that contour compared to what we see a little bit later. So 2010, age 17, looks about the same. Not much has changed. 2011, age 18, again, fairly unchanged, has some different kind of makeup on, whatever, but a very normal 18-year-old girl without any plastic surgery that I can see. 2012, age 19, again, doesn't look like she's had any work done. 2013, at the age of 20, I'm starting to see some changes. I think that she's had her first rhinoplasty at this point. If you look at Ariana's nose here, the bridge is narrower, the tip is less bulbous, the tip is slightly raised, and there's a bit more nostril exposure, which is another giveaway for a rhinoplasty. Doesn't mean it's a bad thing, it just means that that's oftentimes what happens when you adjust the tip cartilages. You get a little bit more nostril exposure, and so that's what we're seeing here. Guys, please make sure to subscribe to the channel if you're not subscribed already. We have lots in store, and this is just the beginning. We're doing a lot of these celebrity videos because you guys are asking for them, so turn on your notifications, like the video. Let's keep going. 2014, age 21, the angle of the mandible, which is this area here, it's called the gonial angle, it appears more defined to my eye, so possibly this is the result of filler, or maybe even at this point an implant into that area. And a lot of people online will talk about a chin implant that she may have had, even though she already has a prominent chin, but just to kind of equalize the sides here, the wings of the chin, I think possibly there's been an extended implant that has also improved the gonial angle. Also, at this young age, 21, I'm seeing signs of a brow lift, most likely performed endoscopically inside the hairline. One of the giveaways here is the positioning of the eyebrow. The left one looks like it was lifted more than the right? So there's this asymmetry, the left higher than the right, and you'll see that play out for a number of years until some of the more recent photos that we have of, I think, just within the last year, where she likely got that corrected, as you'll see. Keep watching. 2015, age 22, it looks to me like Ariana may have had a canthoplasty, because the tilt of her lateral canthus is even more elevated, despite the makeup that she has, but it's even more elevated than what I was seeing prior, and that's kind of turned her eye shape into something a little bit more almond shaped that some people like. So that looks to me like it was likely done at a around that time. 2016, age 23. It looks to me like the lips have been filled with some filler, likely a hyaluronic acid-based filler. Now the upper to lower lip proportions are closer to a 1-to-1 ratio, and it looks like she's had some cheek filler as well. Age 24, I'm seeing a pretty stable image, not too much has changed. 2018, age 25, also about a stable type of image. 2019, age 26, Ariana, I think, has gotten even more lip filler. So now there's probably some of the filler from before, and she's added to that with an additional syringe or more of HA filler. So you're seeing that here. You know, I was wondering about that tooth show that I'm seeing, and maybe if she had had a lip lift. I looked back at some of her original photos when she was younger, and when she opened up her mouth on a pose that we call repose, actually, like this, I could also see tooth show, and the shape of her teeth, especially those central incisors, I think is pretty stable from when she was younger. So I do not think that she's had a lip lift, by the way, in case you were wondering. 2020, age 27. I think you can really see the outline because she's so thin, right? So you can really see the outline of that jawline implant. And I think it's an extended type of implant that's not just augmenting the sides of the chin, but also stretching on to this angle as well. That's what I'm seeing, at least in these pictures. It's a very, very clean jawline, but it looks to me like there's some surgical work that's been done there. Now in 2021, at the age of 28, this is just this year, I think that she's had a revision rhinoplasty. So the tip of the nose looks even more refined than it did after her first rhinoplasty. And now there's an even more obvious, what we call a supra-tip break. And that's that area right over the tip of the nose. And we have a whole rhinoplasty modeling video that talks about that in more detail. Make sure to check that one out. So the supra-tip break, right, then goes into the bridge. And it looks like that division has been more refined with this second rhinoplasty surgery. It looks like she likely had a revision brow lift because now the brow height is a lot more symmetrical, and she may have combined this brow lift with a ponytail facelift. It's possible because if you look at the nasolabial folds, they look more effaced, and you can do that with filler, but it starts to take on a unnatural type of appearance over time, especially if you're doing large quantities of nasolabial fold filler. So I think just based on the tightness of her face and the way that it looks stretched back, and again the shape of the eye and the brow repositioning, I think she may have had a ponytail facelift, which is a very young age to get something like that. So again, I could be wrong, but that's just an educated guess. We don't know for sure, of course. So I wanted to then kind of give you guys just like a general warning. And I know for Ariana it's different, maybe because she's, you know, this huge international pop star and has a huge, you know, following. So maybe different, and she needs it for her job, or at least she feels like she might need all this stuff for her job. I would hope that she wouldn't need it for her job, but you know, that could be some of the pressures that some of these top stars are under. But just like a warning in general about getting plastic surgery at a very young age and starting that early, especially when you're doing a lot of different aging face type of surgeries. When you start at a very early age, first of all, the expenses add up, right? Because with no surgery is perfect, so you might have, like what she had after the first brow lift, some asymmetry, right? So now you're getting another surgery to correct that symmetry. It kind of goes on and on, right? And then if at age 28 you're used to a pretty tight appearance, you might notice that 3 years later there's going to be a drop. So now you're going back in, doing more surgery. Over time, even by the time you reach like, yeah, still a fairly young age, like 50, you will have had so many plastic surgeries that, you know, can build up scar tissue and have some ramifications that aren't always so positive. So just a warning to put out there to young folks who are seeing this video or seeing just all the different plastic surgery content thrown at them and considering doing this stuff. Just have to be super careful and know what you're getting yourself into, and be careful with like doing a ton of combination procedures that really will add up over time and could have some ill effects over years that you don't even anticipate now. Back to Ariana Grande, a summary now of all the different surgeries that I think she may have had up to this point, right? She's only 28. And I'm gonna give you prices here, rough estimates. Rhinoplasty, about $10,000 to $20,000, this is the range. Revision, rhinoplasty, $15,000 to $40,000. Jaw, cheek, lip filler with some maintenance, right? Figure $10,000 a year for over the course of about 7 years. Jaw implant, if she had that, $10,000 to $20,000. Brow lift, $10,000 to $20,000. Brow lift revision, $15,000 to $30,000. Canthoplasty, $10,000 to $15,000. Ponytail endoscopic facelift, $30,000 to $80,000. If you add that all up, at the higher end of those ranges, you're looking at about $295,000. $295,000 to look as exceptional as Ariana Grande. It's not for most people. So keep that in mind when you're seeing your celebrities, especially when they're repeatedly denying having had surgeries. Not only are some of them having surgeries, and sometimes many surgeries, they're not then revealing it, and I don't think people have a sense of how much all of this can cost, so it can get very expensive very quickly. Did I miss something? Make sure to let me know in the comments below, and also make sure to check out those body positive hoodies that we now have, and a chunk of that money is going to charity. And if you enjoyed this video, make sure to check out my analysis of Madonna's facial surgeries, so click on the card and I'll see you there. Okay, thank you guys so much. See you.